A daily weight loss pill with no needles, no morning fasting and no food restrictions. That's the promise behind Foundayo, the newly approved oral treatment from Eli Lilly. Welcome back to Ask the Expert. Whether you're considering starting or you've just taken your first dose, this is your guide to how it works, what results to expect and how it compares to injections like Mounjaro. I'm Aamina Rafiq, Superintendent Pharmacist at Simple Online Pharmacy, and joining me today once again is our Chief Clinical Officer, Abdal Alvi.
Really nice to be here.
Nice to have you back, Abdal. So let's get straight into the most basic question that we're getting from patients. People know Eli Lilly for their weekly Mounjaro injection, and now that Foundayo has been approved, what exactly is this tablet, and is it the same medicine as Mounjaro?
So the quick answer to that is that it's not the same medication as Mounjaro.
Okay.
Foundayo contains a medication called Orforglipron, and Mounjaro contains a medication called tirzepatide. Mounjaro works on two different receptors in the body. Foundayo works on one. And of course, Mounjaro is a weekly injection, but Foundayo is a daily tablet. So although they're made by the same manufacturer, they have got pretty significant differences.
Okay, thanks for explaining that, Abdal. And moving on, our patients are naturally wanting to look at the data behind this medication. So what kind of weight loss results were seen in the clinical trials with Foundayo?
So they carried out a global 72-week trial called ATTAIN 1. And what that found is that patients that are maintaining on the highest doses can actually be losing anything up to an average of about 12.4% of their body weight, which is really very significant. And in fact, that trial also found that about half of patients can expect to lose at least 10% of their body weight. So the trial data does back up the fact that this medication can be really successful for patients.
Okay, thanks for explaining that, Abdal. So with other oral GLPs, patients have to follow a strict morning fasting rule and having specific water limits. But why is it that Foundayo is completely different when it comes to daily routine?
Because it's a different type of medication.
Okay.
It's whereas the Wegovy Pill, which is the one that you're referencing, is a peptide by its nature. This one is a non-peptide, what we call a small molecule, which means that the way that it's absorbed in the body is different to the Wegovy Pill. And so it doesn't need the special snack technology that prevents the Wegovy Pill from being absorbed too fast. And as a result, it means that you can take it any time of day. You don't have a fasting restriction prior to taking it, and you don't need to not have any food or water or medications for 30 minutes either. So if anything, you can think about it like an anytime pill.
Okay. Amazing. Thank you for that. Whenever a new oral medication launches, patients worry about stomach comfort. What does the side effect profile look like for Foundayo?
The side effect profile for Foundayo is actually very similar to other GLP-1 medications, both injections and oral tablets as well. People can experience what we would term gastrointestinal side effects. So that would be mild to moderate nausea with possible constipation, possible diarrhea as well. But the important thing to keep in mind is that most of these side effects do settle if you just give your body some time to adapt. And this really talks to how these medications actually work and how you're supposed to take them, because ideally you start off at the lowest dose and your body starts to adapt, and you only then titrate up at the point at which you feel comfortable. So absolutely they can cause side effects like the other medications within this class, but in the vast majority of cases it's nothing to worry about. They do settle with time. And of course, our clinical team is here to help and support patients. Absolutely.
So patients now have two major daily oral options on the radar. How does Foundayo compare to the Wegovy Pill?
So the Wegovy Pill, by its nature being a peptide medication, does have certain restrictions about how you can take it and when you can take it that allows it to work better. So you need to be in a fasted state, and ideally you take it in the morning and you don't have any food or water or other medications for 30 minutes. Foundayo doesn't have those restrictions, so you can take it at any time of day, morning or night, but we would advise that patients take it at the same time every single day, just for continuity, and it tends to improve compliance, so patients do remember to take it if it's at a set time. The other thing is that Wegovy, as per the studies, can offer a higher amount of weight loss overall, at around about 17% average weight loss compared to 12.4%, which is what we saw with Foundayo. But that's not to say that Foundayo is not going to work really well for a lot of patients. And of course, averages are the midpoint, so certain patients will lose more than that. And I think that convenience is really the key factor here, because patients can take it at any time and they don't need to follow a more strict routine. It will certainly suit more patients, or certain patients more so than Wegovy Pill would.
Thanks for that, Abdal. So since both come from Eli Lilly, why would someone choose the daily Foundayo tablet instead of the weekly Mounjaro pen?
Although both are made by the same manufacturer, it's really important to note that they're two different medications. And I think that I've seen this where a lot of patients are referring to Foundayo as the Mounjaro pill simply because it's the same manufacturer. It's not the Mounjaro pill. You know, the medications between the two of them are different.
Yep.
With Foundayo, you've got a tablet, it's a daily dosage, and, that it talks to the convenience that some patients might experience when they're traveling, for example, or around storage requirements. With Mounjaro, it's an injection, you use it once a week. And again, some patients might prefer that because then they don't need to think about taking a tablet every single day. So absolutely, both of them can really help a person lose weight or to maintain weight loss. But in terms of the medications, they're different medications. They work in different pathways, and they have got a different routine in terms of how you take them as well. So it's important not to get that confused.
Yep. And just to maybe add on to this, the difference between both medications, as you said, storage requirements. If a patient even starts with the injectable form, after first use, the pen can only be used within a certain period of time. So in a scenario, if somebody's using the starter dose and they need to take a break in treatment for whatever reason, but they wanted to restart on the medication, the injectable pen could be expired. However, with the tablet form, the expiry will be whatever is set with the manufacturers, which is a lot longer. So if you started the medication, you could take a break and then you can restart with the medication that you have. So from a cost perspective as well, that might be a reason why some patients might decide to go for it. But again, like you said, it's all to do with the results that patients are seeing with clinical trials, comparing it with the formulation as well. If you prefer and you're happy with taking a weekly injection over daily tablets. So lots of different things to consider, but again,
absolutely. And again, this is why our clinical team are there to help patients make that decision. And it's not an easy decision to make, right? Because you're committing to a medication that in a lot of cases is expensive, and you're unsure about the type of outcomes that it's going to have for you. But we should really be encouraging patients to rely on the experience that our clinical team has built up over the years, right?
Of course.
We're really well placed to help patients make those decisions. So, yep.
Thanks for that. We're getting asked this constantly across all new weight care treatments. What is the reality of accessing Foundayo through the NHS?
As per any new medication, when it first comes to market and is granted market authorization or a license to be used in a particular country, normally the NHS needs to go through a process whereby they're looking at the effectiveness and the cost effectiveness of the medication as well. And then normally it gets approved for use, but it tends to be maybe slightly more restricted in terms of what private providers such as our Simple are able to do. And as a result of which, it tends to be through the private route that a lot of patients are able to access these medications first. And again, that doesn't take away from the fact that there's an assessment, the fact that we have our patients' safety absolutely at the forefront of all of the decisions that we make. But when we're talking about access, currently and as it stands, it is the private route is the only route really that a person can go through to be able to access these medications. And the NHS at some point will absolutely offer these medications, but normally that's slightly more restricted in terms of who would be eligible.
Once a patient is approved and receives their medication, what is the best way to take Foundayo day to day?
So it's a tablet form that it comes in, and it's important that patients, first of all, when they actually receive their package, that they get familiar with it and that they have a good read of the patient information leaflet, which obviously goes into a lot more detail in terms of how to take the medications and what to expect from their journey. But generally speaking, you take one tablet and you take it whole, and patients need to make sure that they don't crush the tablet, they don't break it, they don't half it, they don't chew the tablet. Quite often patients who maybe don't like taking tablets are inclined to want to try to crush it down. We wouldn't recommend that, and that can certainly affect how the medication works and how successful it might be for patients. So you swallow it whole, and ideally you take it at the same time every single day.
Okay, perfect. So for patients who maybe need to crush their tablet, or their preference isn't taking tablets, or they can't swallow tablets whole, then the injection is probably a better suitable alternative for them then?
I would say so, yeah. And in that case, yeah, we would recommend that patients use the injection. I would also call out the fact that unlike the Wegovy Pill, which has got pretty strict conditions about having to be in a fasted state before you take the tablet, and then taking it with a certain amount of water, and then not having anything to eat, drink, or other medications for 30 minutes, those types of restrictions don't apply to Foundayo. So when we say that you can take it any time of day, it means that, yeah, you can take it with any amount of water, and you can have food or drink or other medications straight after if need be. So that restriction isn't there for Foundayo.
Thanks, Abdal. Many patients take daily blood pressure tablets, multivitamins, or thyroid medications. Does Foundayo interfere with those routines?
So the Wegovy Pill does have a 30-minute restriction. After you take the Wegovy Pill, you shouldn't have any other medications. So the first thing to note is that with Foundayo, that's not the case. Having said that, unlike a number of GLP-1 medications, Foundayo can have an interaction with certain common medications, such as simvastatin. And that's why it's really important that patients, when they're filling out their assessment, are very honest and accurate about the medications that they're taking. And of course, in that process, we can recommend any suitable alternative. The nature of GLP-1s, of course, is that they slow down the digestive tract, and as a result, they can have a knock-on effect on certain medications. And one of those effects, particularly with Foundayo, is on patients that take oral hormonal contraceptives. So for patients that are using these medications as a result of the slowing of the gastric tract, patients should ideally use an additional contraceptive barrier method while taking Foundayo, both for 30 days on initiation, and then every time that you titrate up a dose, you should follow that same advice for 30 days. So in other words, if you, let's say, titrate up 2 steps, but then decide to maintain, then after that 30 days are up, you don't then need to use additional contraceptive measures. At that point, the oral contraceptive will work as intended.
Okay, that makes sense. Thank you. So just like the injection pens, patients don't start at the top strength. What does the dosage step-up schedule look like for Foundayo?
So the Wegovy Pill has got 4 titrations, and Foundayo has got 6 titrations, which makes it very similar to Mounjaro injections as well, which of course are made by the same company. And before I go through the strengths, it's really important to note that the strengths between medications or between formulations are not equivalent.
Okay.
So in other words, you can't think that because Wegovy injection maybe comes as a 2.4 milligrams, that is in any way comparable or directly comparable to a higher number of milligrams that you might find in a tablet, because they work in different ways and they are different medications as well. So for Foundayo, the starter dose is 0.8 milligrams, and that's the sort of the initiation dose. That's the starting point upon which you then can increase, as long as the medication has suited you and that you're not getting side effects. That then jumps up to 2.5 milligrams, then up to 5.5 milligrams, then up to 9 milligrams, then to 14.5 milligrams, and the highest strength is 17.2 milligrams.
Okay, so the key message is they're not equivalent to Mounjaro or to the Wegovy tablet or any other medication that might be working similarly.
In other words, don't compare the numbers. Yep. So if you see Foundayo and it says 17.2 milligrams, you shouldn't think that in any way is an indication that it's going to be stronger than Mounjaro 15 milligrams, just because the number of 17 is a higher number, right?
Yep.
And a lot of patients get mixed up by that. And that also means that when they're thinking about wanting to move between medications for whatever reason, they think that the doses are equivalent. That's not the case. And again, that's where our assessment aims to show patients what the most equivalent and best dose for them would be.
Ideal, thank you. So we have patients who currently are on weekly injections who want to switch over to Foundayo. How do they transition safely without a treatment gap?
Well, if you take a weekly injection, that's going to stay in your system for 7 days, right? So if you are looking to swap over, you would use your injection or the last dose of it, and then you would wait a full 7 days. And after the full 7 days, then you can start taking Foundayo. And of course, Foundayo is a daily tablet thereafter. What's really important though, and again, this is where it's really important for patients to be declaring all of this within their assessment, is that the assessment will actually show patients what the best dose and the most appropriate dose is for them to be swapping over to. And of course, our clinical team are here to help patients with that decision as well.
So, Abdal, what about patients who have reached their goals for weight loss and are now wanting to maintain, and they're switching from an injectable to a tablet like Foundayo?
And we do expect that patients will have those switching behaviours. And one of the reasons for that specifically with Foundayo is that there was a trial called ATTAIN Maintain that actually looked at the effectiveness of moving over to Orforglipron, which is the medication within Foundayo, for maintenance purposes. I think it's important to note that when patients do want to swap over, we naturally will start them at the most appropriate dose for them. Because it's a new medication for them, and we don't want to start patients too high so that they experience side effects. Now, what that can mean is that when you swap over, patients can start to get some hunger signals again. And as a result of which, some patients worry about that and they think, right, do I need to now move straight back to injections? We would really advise patients in that scenario to be patient and to give their body a little bit of time to adapt to the new medication. And of course, if need be, they can titrate up. And normally by going through that titration pathway, that's what's going to bring that appetite suppression and allow them to maintain in the long term effectively. More generally speaking, if a person is looking to move over from injections to the daily tablet, then injections by their nature tend to be weekly. So you would need to wait a full week before you start taking the Foundayo tablet. And of course, our assessment and naturally our clinical team are there to help patients decide what route to take and what would be the most appropriate dose for them.
Thanks for that, Abdal. A crucial question for long-term planning. What happens to a patient's weight and appetite if they stop taking Foundayo?
Obesity by its nature is a chronic relapsing condition. And so a lot of these medications ideally would be taken in the long term by patients. And when patients do stop using these medications, Foundayo included, then a person's weight could potentially go back up. And of course, they can start to get those hunger signals again. And that's the reason why we're always telling patients that they need to be building up sustainable habits, either through exercise and movement or through diet, so that when or if they do ever decide to come off the medications, it's much more easier for them to sustain their weight and prevent that rebound that patients can experience.
Yeah, so the key is, I think, for all GLP-1 medications is to ensure that you're making changes to your lifestyle if you're on a treatment like this, because eventually you may stop the treatment for whatever reason, but if you haven't established good eating habits and movement into your life, then when you stop having a medication like this, the appetite is definitely going to come back eventually, and you're also going to have regain weight. So
absolutely. And I think I would add to that it's important to note that a lot of patients, especially ones that titrate up to the higher doses, they sometimes feel as though taking a step downwards in terms of the lower doses is exactly that. That it's a step down, and that, you know, they're going to be disadvantaging themselves. If anything, we might find that patients who are considering coming off the medications, and that might be for cost, it might be for other reasons, are actually better to step down a couple of doses, right? Not only would that be more affordable for them, but it would also allow them to continue to get a dose of medication in their system. And again, that would help with appetite signals and to prevent rebound of weight as well. So there's a number of options there, including lowering your dose. And the key thing is, you know, our clinical team are there to help patients in terms of what's going to be the best path and the best choice for them.
Absolutely. So Abdal, before we wrap up in the studio today, let's look at the bottom line for someone who is on our site right now. If a patient is looking at our online assessment form and is trying to choose between a weekly injection, the Wegovy Pill or Foundayo, how should they decide?
So there's a number of factors around that. And for certain patients, it will be cost, for example, and that might be the defining factor. For certain patients, it might be convenience of a once weekly injection versus a tablet. For certain patients, it might be the effectiveness of the medications, and that might determine what journey they want to go down and what path they want to go down. For other patients, they may have even used these medications before and maybe have had side effects or an experience that made them come off the medication, and so an alternative is an option for them. The key thing is that patients are honest and open in their assessment and about what they're aiming to achieve as part of this weight loss journey. And both our assessment and our clinicians can help them choose the medication that's most appropriate for them.
Amazing. Thank you so much for that, Abdal, and thanks for joining us today.
Thanks for having me.
Finding the right weight management pathway comes down to what fits your lifestyle and medical history best. If you want to explore treatments that are available or speak with our clinical team, you can find the full information and guidance at simpleonlinepharmacy.co.uk. If you found this breakdown useful, please like the video, subscribe to our channel, and leave your questions in the comments below. We'll see you in the next one.